now. Keep your texts and your comments coming in. As I say, inundated with texts and comments. We will try to get as many through in on the programme. Catherine Fitzgerald texted last night regarding the Facebook post about the soldiers. As the mother of one of those soldiers, it's absolutely disgusting treatment of any human being. They also have a duty. There's wives and children's. The tour should be completed. They should be applauded for what they are doing, and they should be getting a date straight away to come home. Other people texting in about different matters regarding the communion dresses. I had to say I thought that woman was spending too much money on the communion dress, says this texter. Another one saying, I bought a communion dress 2 years ago, most expensive thing in the shop, but I can tell you €600 is very, very much. €400 would be the most. I do agree about the bouncy castle thing. She should be getting her deposit back. Unfortunately, everyone's health is more important, and being a health worker, people should know that. So we're going to stay with health matters for a minute. I think we've Dr. Geoff Plant on the line. Good morning, Dr. Plant.
Good morning, Damien. How are you? And good morning to your listeners.
OK, good to talk to you. We are good and hope you're keeping well. I know you're on a mobile phone, so the quality may not be brilliant, but we shall give it a go.
OK.
There are some matters coming up this morning regarding how GPs, and I heard the head of the GPs Association on radio this morning as well, regarding the latest in testing and the ability of getting tests back quickly. Can we just deal with this first? If somebody is tested for COVID, how quickly now should they be getting the results back?
We have been relatively lucky here in the last 3 weeks, I'd say, Damien. The results aren't too bad at the beginning of this. Your listeners may recall it was all a bit of a mess when it came in first. Everyone could get tested and get tested quickly. Get tested for any sort of reason, but it was taking, in fact, we were getting results back 6 weeks later, which was a bit of a, completely useless. I would say in general, there's been times I've seen results back within 24 hours, which is incredible. And then most commonly, I'd say maybe 2 or 3 days, we're getting them back here at the moment. Now, there are individual cases where I've heard of about a week, and there are individual cases where it's quicker. So I'd say an average 3 days would be where we're getting them. But I do understand around the country where there's more of a higher activity with COVID, there is waits of up to a week, 10 days, which is very, and that's what we don't want. It makes the test very difficult to interpret, and it also kind of makes, the whole reason for doing it goes out the window.
Yes, we'll talk about obesity in a minute and a stigma developing. I want to ask you a question from a texter. Could you please ask Dr. Plant, is it safe to go to the dentist at this time? I need a filling.
Now, one thing I can't comment on is the dentist. I am aware that most of them have been closed since this started. I am unsure of what has reopened and what has not reopened. So I would advise the listener to contact their dentist. I understand a lot of them will be rung back anyway, but I'm not sure what the opening is or whether some of them have reopened. My understanding maybe about 10 days ago was that they were definitely, most of them were still shut. So,
yes. We'll get on to them, yeah.
A good bit of that stuff.
Yeah. I presume from a medical perspective, that's why the text came in. In terms of obesity, medical experts are, I suppose, expressing concerns that a possible stigma is developing, Geoff, that obese people are spreading coronavirus and that such patients could be discriminated against when normal health screening returns. This is ridiculous, isn't it?
This is the first I've heard of that. Why obese people who are obese would be more of a spreaders than anyone else, I think is not true. Now, where there is a bit of truth, so I'm going to knock that on the head actually there and say I don't think that anyone with obesity is more at risk of spreading coronavirus than anyone else is right now. Anyone else, okay, including your 5-year-old child, including your 90-year-old person. I don't think that's true at all. But unfortunately, there is a link with obesity and poorer outcomes in the people who get severe COVID. Most of your listeners are probably aware at this stage that 80% of people who get coronavirus will be fine, and they might be sick with a flu-like illness for a week or so, and they recover fine. So what is uncertain from a medical point of view is why a certain small percentage become very unwell, that 2 or 3% who need kind of ICU or high dependency in hospital. And there are certain cohorts of people who are more at risk of getting that, the elderly, which we all know about at this stage, diabetics and people who are, some other people who have got multiple medical issues. But obesity is definitely in that category. And I know some of the stats from London I read last week where if you had obesity, diabetes, and particularly if you were African descent or Asian descent, that your outcomes were considerably worse than others. So I think that might be where it's coming from a bit, Damien. I do not think, though, I just want to be clear that I do not think that obese people are spreading this more than anyone else. That is just not true. Yeah,
it comes from the Irish Society for Clinical Nutrition and Metabolism. They're warning about this possible stigma matter, and as you say, there's no medical evidence whatsoever.
Yeah, from my point of view, I'd like to throw that stigma down the river now. That's just not true. But just to be aware that unfortunately, now we talk about fat shaming and people with obesity being fat shamed a lot, and people being proud of their bodies, and that's a great conversation to have. There is a but to that, I always say, is when we tell people that they are obese or overweight, we're doing it from a health point of view to try and assist them in having a healthier life. So unfortunately, whether we like it or not, being obese increases your risk significantly of having diabetes, of having high cholesterol, blood pressure, heart disease, stroke, fertility problems, gallstones, gout, kidney problems, asthma. There's many things that are linked with having obesity. So when we do it, and some people, we bring it up with people regular as they come into the surgery, and some people, most people take it very well and understand that it's an issue and they're trying to address it. Some people get offended. So it's, from a medical point of view, we're definitely not trying to stigma people or offend them. We're just trying to help them lead a healthier life.
Yeah, and there are 1 million people clinically obese in Ireland, so it is a big issue. Can I ask you another specific question, Geoff, if you don't mind, finally? Someone who's tested positive for COVID, says this person, should the whole family isolate, and for how long? For example, apparently contact tracing called the family. They don't have symptoms, so they weren't told to isolate. That's a good question.
Okay, now I would refer that family to the HTSC website. I know you've heard me mention it a lot. That will be covered very exactly in that website. Off the top of my head, they don't need to fully isolate, but they need to have restricted movements. Now, we all are having very restricted movements still at the moment, but there's a little. So if you look up the word restricted movements, I'm pretty sure the family will fall into that category of restricted movement. So it's not full isolation, but it's restricted movement. There is a subtle difference.
Okay. Geoff, thank you very much for joining us this morning.
No problem, Damien.